Thank you very much, David. I'd like to welcome all of you to this session also, but particularly thank Margie Peden and Gail DePietro and Evelyn for coming from Geneva and spending this time with us. So thank you for your participation, and thank you to all of you. I'd like to recognize those of you who've come from across the street in Baltimore, as well as those who are coming from Washington, D.C., and of course, colleagues from around the university. What I would like to do is simply take a few minutes, and I'm going to cut short my talk a little bit because I know we are running a few minutes late and I want to preserve the time for some question answers, but really give you a snapshot view of this product, which is based on our work over the past 18 months or so. It's taken us about 6 months to produce the special issue. So basically from about early 2010 to the middle of 2011 is when some of our descriptive data was being collected and is now published in this particular special issue. I have to tell you that we are very lucky that at least one paper from every one of our 10 countries is included in the special issue. There are a total of 11 papers, including an economic analysis. Over 50 colleagues, both from Johns Hopkins, our country collaborators, and our partnering organizations have participated. Also, more than 30 reviewers have been involved in peer review of this special issue. It went through all the standard processes of review, revision, and acceptance, like any other peer-reviewed paper. So you've already been introduced to the 10 countries that we are working in, and what I'm going to do over the next 10 minutes is simply spend a minute and highlight to you the papers that are coming through in this special issue so that it whets your appetite a little bit to read it. We begin the special issue with 2 editorials, not only from myself and David Bishai, but also we were very fortunate that Kelly Larson and Dr. Kelly Henning from Bloomberg Foundation Philanthropies, as well as Margie, participated in commenting on the special issue, and I'd encourage you to read their editorial. The first of these 10 papers is from Mexico, where Professor Martha Hijar, Dr. Aruna Chandran, and colleagues have quantified the mortality estimations that are done in Mexico. And in a nutshell, what they are demonstrating is that this data has to be adjusted because there is underreporting of road traffic injury mortality. And no matter which way you find to adjust it, you see that the blue line is fundamentally lower than every other line. And the blue line are the reported figures. Everything else are adjusted figures using different methodologies. And that's the fundamental lesson to be learned from this first look at data from Mexico on road traffic injuries. The next paper that we have is also led by Dr. Chandran and colleagues from the Vida no Transito team, which is our RS10 project in Brazil. And this data really looked at the influx of pedestrian and the impact on vulnerable road users in Brazil. In fact, Latin America is being infiltrated by a hoax of motorcycles. And these motorcycles are having now a huge impact on mortality trends. And in fact, as Aruna and our colleagues are demonstrating, there is over an 8-year time span nearly a 300% increase in the health outcomes associated with this group. As you can see on this slide, we saw over these 8 years a trend of rising mortality rates for vulnerable road users. And when they dug down, they found out that a leading impact was really the motorcycle occupant injury and death rate, as opposed to some of the other groups which tended to remain more stable. A very important finding from the Brazilian Ministries of Health and Transport. Our team in India, together with students like Maxwell Barfour and Dr. Shivam Gupta, Professor Guru Raj, who we work with, looked at the availability of data in India. And very interestingly enough, they found that they had particular parameters they were looking for, useful information that could be obtained from national databases in the police and transport sectors in particular, and they found that they couldn't trust one database alone. They had to combine these databases. Otherwise, they were missing most of the information. So using your Pareto principle, Margie, 80% of the data required the merger of at least 3 national databases. Dr. Bachani and his colleagues in Kenya have worked very closely with the Ministry of Health and other colleagues there, looking at risk factor data in Kenya. We are operating in 2 districts in that particular country. And what they found is that, in fact, every year they are noticing an increase in road traffic injury death rates. The average estimates are about 7 to 10% per year throughout the past 5 to 7 years, and particularly vehicle passengers being affected in Kenya. The paper from Cambodia, led by our team there, again, Abdul with his colleagues at the Handicap International, who are our collaborating team in Cambodia, have found that in fact motorcycle helmet usage, there are some critical issues there. While about 50% of motorcyclists are wearing helmets during the daytime, that drops radically when night falls. And the other risk factor that emerges close to dusk and nightfall is alcohol. So you have a reduction in helmets, you have an increase in alcohol, and therefore you get the risk of road traffic crashes very, very high. And when we asked people, those who were wearing helmets, why do you wear them? We got responses not only from, oh, they saved my life, but really in terms of, well, it's the law, or really we're very scared of being fined by the police. So this mixed notion of not only personal incentives, but also the impact of enforcement. We have a lot of work to do in Cambodia, clearly. Our colleagues, led by a former colleague, Dr. Nan Tran, who's moved on to WHO now, working with our team in the Hanoi School of Public Health, worked there to do more of the knowledge, attitude, practice type of surveys. And we thought that people would hide the fact that they drink and get on the roads. In fact, 60% of people acknowledged that, yes, they have drunk and been able to drive at the same time, which of course is a tremendous risk factor. When we asked them, what would you have liked to have done? They gave suggestions such as leaving parties with non-drinkers, feeling very conscious. They have their own sense that we want to be in our head before we get on a bike. And of course, a few people said we might want to drink less before we get on the motorbike. Working in Egypt has been a challenge, but we've worked very successfully, at least for the first year, collecting some initial data. Dr. Prashanthi Puvanachandra and colleagues at CAPMAS in Egypt looked at data systems. And this review of data systems indicated that, in fact, when you look at the risk factors that are part of road safety in 10-country projects, although you do find data on crashes, injuries, and deaths, there is really no information on risk factors. And this is a huge gap. They looked at this very carefully, in fact, and the paper that you will read highlights that, in fact, there is some imperfect and underestimated, but there's actually information on things like injuries and deaths that happen in the population. When you combine multiple sources, you unfortunately tend to get disparate pictures of the burden. But very importantly, risk factor data is actually missing from most of these databases in Egypt. Dr. Sai Ma has been working very closely with China's Centers for Disease Control in our project in Suzhou and Dalian, and they've also looked at some of the initial data sources that come out from there. And China is very interesting, because when we look at data that is reported formally by the ministry, and then we look at data that is reported formally by the police, and then we say, wait a minute, what about the health data? And you look at Ministry of Health, and you look at their disease surveillance system. Actually, the health data is about 3 times as much as police data. Unfortunately, the formal notification by the government of China is always through police channels. So the numbers they in fact report to the World Health Organization are far fewer than what we believe is the truth. The challenge, of course, is making the government accept the truth, which is something that we have to do very, very carefully. As Margie has pointed out, the grand realities can be very different than simply publishing a paper in a journal. We're actually very pleased to be working in Turkey. Turkey is a middle-income country with some parameters that are very European and other parameters that are amazingly surprising, that are reminiscent of low-income countries. And Dr. Puvanachandra, working with the Middle East Technical University, has been looking at this burden. And in fact, once again, we found we were expecting a tremendous amount from data sources in Turkey. Unfortunately, data sources in Turkey, despite the fact that we might think that it's a part of a European paradigm, are actually quite depressing in terms of risk factor data, in terms of usage data. This was really surprising to us. But that's the reality we are working with, and we are now putting in our own observational studies, both in Afyon and in Ankara, to supplement this. They do have a very sophisticated system of collecting data, both from transport and police sectors, on injuries and deaths. There are some variations in definition, but in fact you find pretty high crash rate, over 1,000 per 100,000 crash rate, injury rates of about 300 and fatality rates which are about 6, some of the higher in the European Union. Once again, we are now working with our colleagues in Turkey, demonstrating this gap in information with respect to risk factors. We also have our colleagues, led by Dr. Saima, working with 2 universities in Russia. Russia is a very interesting place to work in. In fact, what we are noticing is that while seatbelt usage is up to 60%, it's really limited to front seat passengers. Backseat passengers are a forgotten entity. And in fact, child restraints are really, really rare. And so once again, the Road Safety in 10 Country project has a huge opportunity to make a difference if we do things the right way, both in Lipetsk as well as in Ivanova. You will note that the special issue ends by an 11th paper, which is not country-specific, led by Professors David Bishai and one of our students, Alexo, where we really looked at looking at what's the impact on the specific sites that we are working in. So this is not national level impact, but focused specifically on the cities that we are working in. Our projection was that over a 5-year time period, just over 10,000 lives could be saved. Dr. Bishai, of course, works in many instances of trying to figure out, well, what's the cost of making this change? What would people pay in order to have this reduction in death? And the estimations show that for these types of reductions, the economic estimates indicate that society would be willing to pay about over $2.5 billion for similar reductions. And these estimates, therefore, can be shown to indicate the potential cost effectiveness of the interventions if we as a consortium are successful across these 10 countries. I'd really encourage you, you have now in your folders, and if you don't have a folders, my colleagues will make sure that you have one. If you have other colleagues who would like one, please feel free to pick up more than one. But these papers are all free access now. We worked with the journal. The journal actually is not free access, but we have ensured that this particular issue is free access, so our colleagues around the world will be able to go and download these articles. And of course, for those of you who would like additional copies, please be in touch with us. I'm hoping that this is a small step, thanks to the funding from Bloomberg Philanthropies, thanks to colleagues like Global Road Safety Partnership and World Health Organization, that the School of Public Health here at Bloomberg School of Public Health, as well as our specific unit, has made a small contribution. And we hope through this project to make similar contributions to the global pool of knowledge around road traffic injury and its